Go for it.
Okay. Despite the fact that we now know that Neil-Patella syndrome is the result of mutations in a gene called LMX1B that plays a role in the development of the nervous system and how the arms and legs are properly formed, the diagnosis of the syndrome remains a matter for a clinician, and the physical presentation of Neil-Patella syndrome is fairly characteristic and is not that difficult to diagnose. And so we'll start with looking at fairly moderately affected fingernails and show those here. So as you can see in this case, the nails are present on all fingers and the thumb as well. But what you can see here is the absence of creases over the distal joint, how this joint is very smooth. And also, I think we see on the other hand, you can see that what's called the luneal, this area at the base of the nail, which I don't have very good ones, but anyway, this would in most people is going to be round, but in Neil-Patella it tends to come more to a point and be triangular. We can see, and along with the absence of the creases, that affects how you can make a fist. So I don't have NPS and I make a fist like this, but someone with NPS has much more greater difficulty, can't do this. See? Because of the restrictions in the joints, and see this hyperextension of the proximal joint and contraction of the distal joint results in swan necking, and this is very characteristic of Neil-Patella syndrome. We also see in the knees, because of the hypoplasia of the patella, how the knee appears very square here. Is that you come down there? And with off to the side, lateral displacement here, and then on the other one, again you see how with the kneecap being abnormally placed. The third feature to appreciate is the elbows, and how it is not possible for many people with Neil-Patella to fully pronate and supinate the arm. And so is this full extension for you?
No, this one's actually.
Okay, but separate out like that, but as in one should normally be able to turn this just from the elbow. You should be able to put your palm up to accept change just by turning your elbow, whereas in people with Neil-Patella syndrome they're usually having to rotate from the shoulder as well.